Stay connected. Make sure you hit the subscribe button. Tim Bennett here from the Cortland Voice, and I'm here with Dr. Omar Taha from Cayuga Health. Doctor, tell us what field you're in, and then also tell us about like where you're from, whether it be your hometown or where you went to college. Let's hear about you.
Sure. Good morning, Tim. So I'm originally from Dutchess County, New York. It's where I grew up. Spent most of my life. I did my education, started out my earlier years in college down on Long Island at Stony Brook University. When I finished up there, I went to the American University of Antigua for medical school. I then spent about 7 years or so in Brooklyn, New York, 6 of those at Maimonides Medical Center, big busy place down there. And I spent 3 years doing internal medicine residency there, followed by 3 years doing a pulmonary and critical care fellowship.
Okay, so that's all downstate. Yes. I lived in Long Island myself. I lived all over Long Island after college. Let me ask you this. How did you end up from down there, like 5-6 hours away, to up here in the Cortland, Ithaca area?
Well, I have 2 small children now, and I was looking at different job opportunities. And, I met the folks here at Cayuga Health, and very great group of people. They made me feel very welcome from day one. And there was opportunities for me to work in the intensive care unit, to do pulmonary medicine. And also there's a young residency program here where I have the opportunities to teach the younger doctors. And that's something I really enjoy. So everything sort of worked out, and they were looking for what I was looking for.
Beautiful. So what you were looking for is like your current role. Tell us that. What is your current role?
So my current role at Cayuga is I'm a pulmonary critical care physician here. I see patients in the pulmonary offices in Schuyler and Cortland and Ithaca. We do sleep medicine and pulmonary medicine, so all sorts of sleep disorders, lung diseases. I also work in the intensive care unit period every month where we take care of the critically ill patients. I'm also the co-director of the intensive care unit. And we try to stay on top of the latest trends and things like that in medicine, what's the newest medications to use for a condition, that sort of thing, to make sure that we're delivering, high quality, up-to-date care. And then I also teach, as I said. So I teach the medical residents usually the various critical care things, how to deal with a patient who has critical illness and that sort of thing.
So for someone listening that might not know what I don't want to butcher the word. I'm going to take my time with it. Pulmonologist. Okay. Or doesn't, if they don't know what a pulmonologist is or doesn't know about pulmonology, explain that to the community. What is it?
Sure. So pulmonology really is the study of the lungs, the study of the airways in medicine. We treat all sorts of different diseases, simple things such as asthma or somebody with a persistent cough after a cold. We also do things like monitor lung nodules and do lung biopsies on potentially, suspicious looking nodules. We also deal with sleep disorders, people who have sleep apnea, who feel excessively sleepy during the daytime, who may not be breathing appropriately at night. It's a very common condition in the United States. So we take care of patients, with those sort of conditions.
I see. Now, do people come straight to you for those issues, or are they normally referred from like urgent care or general doctor, like their primary doctor? Or like how does that work? Is it normally by referral base, or they notice, I have someone has this cough, they come straight to you? Like how can they set themselves up to see you?
Sure. So a lot of patients will be referred by their primary care physicians. Other patients, depending on if they need a referral or not, sometimes they'll need to see their primary doctors first and they send them over to us, or they'll, reach out directly and be able to set up an appointment, depending on insurance, things like that. There's various rules.
So I know that in your field, there's a heavy usage of ventilators. Now, I know since COVID-19, the coronavirus, many have a viewpoint of ventilators. How do you use those, you and people in your field use those in a different way that would not make it as like scary for a person,
Sure. So a ventilator, it is a scary tool for some. We do use them all the time in medicine. It's one of the central tools in pulmonary and critical care medicine. We use them really to help people get through situations, whether that situation is a severe critical illness and we need to support their body until the underlying problem is fixed. Or, for example, if somebody goes in for an elective surgery, a lot of times they'll be put on a ventilator temporarily while the person is asleep and the surgeon is doing what they have to do. Sometimes people with advanced illness, advanced lung diseases like cystic fibrosis or neurological conditions like Stephen Hawking with ALS, for example. Those are individuals who would be on a ventilator sometimes 24/7. In the ICU setting specifically, we use them as a bridge to sort of help people get over an acute illness, get things fixed, and then we get them off. The ventilator, and what it really does is it's a device that's attached to a soft plastic tube that we put through the mouth into the windpipe, and we are able to control volume, pressure, and various different settings to blow the lungs up with air and to give the patient what they need. And there's many different modes that a ventilator can be used in, and there's many different things we can do with it depending on the exact illness that the patient has to try to get them better. Now, as you said, they're sort of a scary terminology, and that is true. And the reason that is because they're often associated with severe illness, and often they're the last thing that we'll try to use on somebody before death occurs. But in general, a person doesn't need a ventilator unless they're in a life-threatening situation, and the risk of death is already very, very high. So early on in the pandemic, there was a lot of hysteria and things like that about ventilators and the illness overall, and people started to speculate that they could potentially be the cause of deaths. And then there was all sorts of rumors and things like that that were coming out. But the reality of it is, specifically for COVID, we try to wait as long as possible before putting a patient on a ventilator. That's the last sort of thing we'll use before death is going to occur, to try to support somebody's body a little longer while they have time to get through the virus.
Understood. So for COVID, it's one of the last steps, but for some procedures, and I don't even know if, like, because me personally, I've had a knee surgery before. I've had surgery on hands, and I went under anesthesia. So there's a chance that they could have even used a ventilator on myself, and I would never even have known during the process. Is that what you're saying?
Well, absolutely. Well, it's usually they go, all the time the anesthesiologist would come and speak to you and get consent and talk about what they're going to do. But a lot of times, a ventilator in those sort of situations is much different than a ventilator in the ICU setting. But absolutely, for routine surgeries, people often do have a tube inserted and are on a breathing machine. And the reason that is because when we're so sleepy, we don't have the consciousness to even swallow our own saliva. And that can go down the wrong pipe, and we can get into trouble that way. So it's
preventative care.
Absolutely. It's preventative for when you're putting the person to sleep and making them comfortable and allowing the surgeon to do what they have to do.
Okay, beautiful. Well, that puts me at ease, in case any athletic injuries or anything like that. It's good to know, doctor. Let me ask you this. Is there any other things that you would mention about, whether it be if you wanted to speak more on the different things that you do? Because I know you are involved in a lot at Cayuga Health, or if there's anything else you want to say as far as your pulmonary program at all. Like, is there anything else that you want to say?
Sure. So we take care of patients with a variety of breathing illnesses here. We take care of, like I said, the lung nodules. We work with patients who have work-related lung conditions from chemical exposures or asbestos exposures or fumes over the years. We take care of people with smoking and non-smoking related lung conditions, asthmatics, again, the sleep disorders and things like that. Restless leg syndrome. These are all sort of things that we commonly tackle. We have 2 fully functional pulmonary function test labs where we can get measurements of people's lung function. We can track their lung function over time if they have certain conditions. We have 2 sleep labs where we can actually do sleep testing. We can monitor EEG waves, people's brain waves while they're asleep, and get information on that. We see patients obviously in person, but also by telemedicine as well, for convenience for some people, depending on what they have. And we're in the process of building a pulmonary rehabilitation program where people with lung diseases or people who are just overcoming critical illness, for example, and are deconditioned, as we say, where they can sort of focus on rehabilitation and being able to walk longer distances with less breathlessness and get their strength back.
Oh, wow. Now, let me ask you this. I mean, I know that obviously, like, we're in Cortland. Can we see you in Cortland? Do we need to come to Ithaca? I mean, I know, well, with a device, we can telehealth with you,
Sure.
but where is it best to see you? Like, if we want to see you, where is it?
Our goal is to be everywhere. Right now, there's myself, there's Dr. Gupta, and our physician assistant, Tammy Walrath, and we all go out to Cortland. There's usually somebody there a couple days a week. And we're able to offer these services out there for patients who need sleep tests and things like that in the Cortland area. We're able to set them up with home sleep studies so they can get checked for sleep apnea or other conditions at home. So we try to bring the services out to Cortland.
Well, beautiful. So, well, thank you for joining us today to educate our community, our greater Cortland area community about, what you and your team offer at Cayuga Health. And to everyone watching, I hope you learned something great today. If you have any questions about your sleep or your breathing, make sure that you check this website, and we will when I say this website, the website that is showing right now on the screen, and you will be able to see Doctor and his team to get those services. Once again, thank you for choosing the Cortland Voice. God bless. Stay connected. Make sure you hit the subscribe button.